Hi everyone, we're here at A4M Longevity Fest in Las Vegas, Nevada, so you may hear some excitement around us. Today we're going to film a Strive sessions from the booth, our Strive booth.
Yes, we're so excited to be here at A4M this year, Longevity Fest 2025. And today for our Strive sessions, we're going to talk about low-dose naltrexone. Definitely my favorite topic to talk about, and very excited to bring it all to you today.
It's one of my favorite topics to hear you speak about as well, and you actually introduced me to it. Megan's been working with LDN for a very long time, and we're excited to hear what it has to offer for us today.
Yeah, awesome. So let's get going. So just our general disclaimer that we put in front of all of our slides that we do.
Yep.
And this is a quick overview agenda that we're going to talk about today.
Yeah, we're going to talk about some conditions that LDN may benefit, including weight management, depression, fertility, Hashimoto's. That's a big one, actually.
Yeah.
And we actually have people who work at Strive that are, talk about their experience with this one.
Yeah, have benefited from LDN and Hashimoto's.
Absolutely.
Yeah.
We've got neurodegenerative disorders, fibromyalgia. We're going to talk a little bit about the origin of LDN. I think we're actually going to talk about that first.
Yeah.
And then some mechanism of action. We're going to talk about some dosing and the products that we offer.
So this is one of my favorite slides to present. These are some of the conditions that low-dose naltrexone may benefit. There are over 80 different conditions that low-dose naltrexone has been studied in, and over 1,000 different clinical articles. It's impressive.
It's really great. And we actually work with another company, the LDN
Research Trust.
That's correct.
Yes.
And you can find a lot of articles there. We include a lot of articles on our info sheets as well. I'm happy to offer any additional information you are looking for. You can always reach out to your sales rep or a Strive representative to get that information.
But some of these conditions, as Valerie was talking about on our agenda, autoimmune diseases, the multiple sclerosis, lupus, arthritis, Hashimoto's, chronic pain syndromes, potentially a great option for neurological disorders like Alzheimer's, ALS, Parkinson's disease. There's lots of great research out there too for GI disorders, irritable bowel syndrome, potentially also long COVID. We know weight loss is another big space where low-dose naltrexone has been utilized in.
We aren't really going to touch on this today, but one of the things that's near and dear to my heart is that LDN can actually be used in animals as well.
Yes.
So there's some conditions there and some research articles out about how LDN works with animals.
I feel like that could be another Strive session.
It totally could.
LDN and pets, absolutely. Mental health and fertility. So the list just goes on and on, as you can see here. And this is, again, why it's one of our favorite things to talk about at Strive.
So tell me a little bit about the origin of LDN. I think I've heard you talked about this Dr. Bihari and how it all came about. Let me hear a little bit about that.
Yeah, it's such an interesting story. So low-dose naltrexone was actually discovered back in the early 80s. And Dr. Bihari was the one that actually was the founder of low-dose naltrexone. So the story goes, he had patients that he was working with, HIV and AIDS patients, who were on a full-dose naltrexone tablet. We know full-dose naltrexone is a 50 milligram tablet, and a typical dose of that is going to be anywhere from 50 to 100 milligrams. Dr. Bihari noticed that some of his patients were actually crushing up the tablets and taking smaller dosages of the full-dose naltrexone. But interestingly, in those patients that were taking the smaller dosages, he noticed improvements in their immune system function, which was a really exciting thing for him, especially being an HIV and AIDS researcher back in those early days.
Absolutely. And what an interesting way to find out how this all started. I mean, just that you just take a smaller dose, you're like, oh my gosh, it might help all these other things. And so then did Dr. Bihari look into other conditions, or did he just focus on HIV patients?
He mostly focused on the immune modulating components of low-dose naltrexone. But as you can see, what we talked about earlier, there are so many different realms that it's used in, and we'll definitely touch on those here in a few minutes.
Yeah, absolutely. So let's talk a little bit about the mechanism of action. And I think there's actually a couple of mechanisms, correct?
Yeah, there's two distinct mechanisms of action for low-dose naltrexone. The first is going to be a temporary opioid receptor blockade. So low-dose naltrexone works on the mu-opioid receptors, and these are present all in the body. And what happens is it sits on that receptor for about 60 to 90 minutes, once the molecule releases from the receptor, it creates what we call the rebound effect. And this rebound effect produces a rush of endorphins within the body. And so this increase in endorphins is potentially great for mood, for pain, modulation, improving immune function. So there's a lot of different mechanisms by which increasing endorphins can offer patients symptomatic improvement. Also, this is where we see the potential for it being used in weight loss as well.
Yeah, absolutely. This to take me back to my pharmacy school days where we learned about the mu receptors. So this is always fun to look at.
Yeah.
Love the diagram here about the mechanism of action.
Yeah. So again, that's the first mechanism of action, is that mu opioid receptor and the increase in endorphins. And another thing to note too about low-dose naltrexone, it's that increase in endorphins. This is why we recommend taking low-dose naltrexone at bedtime. Our body naturally produces endorphins while we're sleeping. So generally between 2 a.m. and 4 a.m. And so we want to take advantage of that natural endorphin release. And that's why we recommend using the low-dose naltrexone at bedtime.
Yeah, and we'll get a little bit into dosing later, but we can definitely talk about the side effects from taking it at night, and then if we can take it in the morning, things like that.
Yeah. So we'll get into the second mechanism of action, and this is really the immunomodulation that's happening. So low-dose naltrexone binds to what we call the TLR4 receptor, and that stands for a toll-like receptor 4. And these are found on microglial cells within the body. So specifically, these are immune cells within the central nervous system. About 20% of the central nervous system is made up of these microglia. And so when it attaches to that TLR4 receptor, what it does is it actually turns those microglial cells from an activated state into a deactivated state. And the beauty behind that is when a microglial cell is deactivated or it's at rest, it's no longer giving off pro-inflammatory cytokines, pro-inflammatory interleukins. So again, by turning off these cells, we are getting a reduction in inflammation.
Yeah, this is fascinating.
Yeah.
This part, to me, is super fascinating. So this can help with a lot of those inflammatory disease states that affect millions of people.
Absolutely, right. Autoimmune, chronic inflammation, neurodegenerative diseases. This is the mechanism of action by which low-dose naltrexone will potentially relieve those.
And I think
symptoms.
before I was a pharmacist, or even maybe during pharmacy school, when you think of inflammation, you're like, oh, I just have an inflamed knee, or something is just, a little bit inflamed. But anything in your body can be inflamed.
Absolutely.
This is where all those other disease states come into play.
Absolutely. And within every disease process within the body, it's going to cause inflammation.
Yeah.
And so again, anything that we can do to tamp down on inflammation, whether it's a change in lifestyle, a change in diet, a pharmaceutical product like low-dose naltrexone, anything we can do to decrease inflammation is potentially going to have beneficial effects and longevity effects within the body.
Absolutely.
So getting into screening and patient selection, I think, this is important. I like to say, when people say, who's a candidate for low-dose naltrexone?
Everyone.
I know, yes.
Almost everyone.
Right. That's my famous line, is just about everyone's a candidate for low-dose naltrexone. So as you can see, obviously, anyone with an autoimmune condition, an inflammatory condition, we've talked about these. Probably the easier list to talk about is
who cannot take it,
exactly,
right? And,
yes.
I like to always bring this question up. Yes, you can take low-dose naltrexone, but are you on an opioid?
Right.
And as we know, the low-dose naltrexone doses, the regular naltrexone doses that are 50 milligrams, 100 milligrams, those are used for opioid substance disorder.
Correct, yes. Yeah.
So this is, if they're already using opioids, we're not going to want them to be on that. And I think we might have a slide later where we talk about if they're coming off of opioids, when would be good to bring on LDN.
Right. Yeah. Again, so exclusion criteria is going to be, like Valerie said, anyone that is on a chronic long-term opioid, or potentially anyone with severe liver or kidney impairment. And that's about it. It's a very well-tolerated medication overall. So
yeah. Next thing, we're going to go into our disease state. So the first one we're going to talk about is weight loss. We obviously talk about GLP-1s a lot, and we want to make sure we talk about LDN as an option, as an add-on option, and how it works for those people.
Yeah. So if you remember back to the mechanisms of action that we talked about, so low-dose naltrexone, again, is going to increase endorphin production within the body. And so that's where we feel that its potential for appetite regulation can come into play there. Because again, by modulating those endorphins within the body, that can help with these food cravings that patients that are struggling to lose weight, deal with. Also, we know that, obesity and inflammation go hand in hand.
Hand in hand.
Yeah.
Yep.
So, anytime that there is extra fat on the body, there is definitely inflammation going on there. And again, through that second mechanism of action, low-dose naltrexone decreases inflammation within the body there. We know that there are studies out there that show it has an impact on metabolism, potentially helping with hormonal balance, also improving sleep. This is a great kind of side benefit of low-dose naltrexone since we're taking it at bedtime.
All of those things can help reduce weight. If you're getting better sleep, if you're having decreased inflammation, if your metabolism's better, like all those things are going to help with your weight loss journey.
Absolutely. Yeah. So again, we think low-dose naltrexone is a fantastic option as either an add-on for a GLP, if you have a patient that is potentially weaning off of a GLP or weaning down to a lower dose. Low-dose naltrexone, again, works through a different mechanism of action to help support the patient on their weight loss journey.
One thing I usually say, and correct me if I'm wrong, is that maybe you've reached a plateau or maybe you aren't losing weight on your GLP-1. Is there an underlying condition that maybe we don't know about, an autoimmune disorder or some inflammation, and then that would be a good time to add on LDN to see if that helps that condition?
Absolutely, yes. And again, we know that GLPs also help with inflammation, but remember, they work through two different mechanisms of action. So you can absolutely use them in conjunction with each other. And I think, like you said, if you have a patient that has gotten stuck or maybe reached a weight loss plateau, that this would be a great potential add-on option for them. Yeah.
We're going to talk about dosing.
Because dosing is definitely different for weight loss than it's going to be for some of those other autoimmune conditions that we'll touch on in a little bit. So for weight loss, we do use a little bit higher dosage. We recommend starting out at an 8 milligram dose at bedtime and then potentially increasing that to twice a day. So taking 8 milligrams at bedtime and then potentially again in the morning if needed for that appetite control.
And we'll talk about our great flex dose option later on in the slide deck, but we make it really easy to titrate up to those doses.
Yep, absolutely. So I think it's always important to set expectations when it comes to weight loss, right?
Absolutely. This is one of my favorite things to talk about. Even if you're on GLP-1s, everyone wants that magic pill, that magic bullet.
Right.
You need to do some changes in your lifestyle as well. So always great if we can do some lifestyle modifications in diet and exercise. And I always like to say, whatever your attainable goal is, what can the patient do that is realistic? If they are eating in and out every day, we're probably not going to change that habit overnight. So now we need to decrease our in and out every day to maybe a couple times a week. Same thing with strength training. Adding on strength training for women, obviously super important.
Prioritizing protein.
Yes, prioritizing protein. Also really big on GLP-1s. I know I'm throwing GLP-1s out there a lot, but you really need to get that protein in. And I find it really hard to prioritize protein. We've talked about this. I think all the protein bars taste disgusting and all the protein stuff. So I've had to go and pick and choose and try and taste all these things where I have found protein that works for me. And your patients will also need to do that.
Yeah, absolutely. No, that's a great point. So again, like we always say, set expectations, manage expectations, and but again, utilizing LDN for weight loss is a great option. Yeah.
So the next one is going to be LDN and IBD.
Yes, irritable bowel disease. This was actually studied starting in the 90s. Low-dose naltrexone was studied for irritable bowel disease, Crohn's, colitis, irritable bowel. And there's some wonderful clinical research out there showing the potential benefits of it for those patients. Even some very interesting studies, and we didn't include them here, but showing that up to 70% of patients can even go into remission on just low-dose naltrexone alone.
Yeah, obviously, talk to your doctor, look at some research, but I just had a friend who was in the hospital with diverticulitis. And I was thinking to myself, you know what, you should talk to your doctor about LDN.
Yeah.
I think that there's going to be some inflammatory, yes, you still need to adjust your diet, but maybe this could be helpful.
Absolutely.
Correct me if I'm wrong.
No, 100% sure, absolutely. Diverticulitis is definitely an inflammatory condition within the bowel. And so, again, we know from those mechanisms of action that low-dose naltrexone helps with inflammation. It helps with immune health. 90% of our immune system is in our gut. So we've got to keep the gut healthy and uninflamed in order to help boost our immune system. And so I love this graphic here, just that cyclical relationship that there is between, fat and inflammation and obesity. And, it's just, how do you break the cycle?
Yeah, and the neuroinflammation. We've talked about this, where we've talked about those neurodegenerative disease states where we're looking at Parkinson's and Alzheimer's and all those things. And like I said, when I was in pharmacy school, I don't think it really necessarily was talked about that these are all connected, and that inflammation in the brain could also be because of these disease states.
Absolutely. And so I think, again, low-dose naltrexone, a great option for these patients for all of these different reasons to break that cycle of inflammation that's happening within the body.
Yeah, absolutely. Now we're going to talk about LDN and depression.
Yeah.
And I mean, this goes hand in hand when you think about it.
Yeah.
And so you'll review it, but absolutely on the same wavelength, where I didn't realize that it was all connected when I was in school.
Exactly.
And I just wish there was more education about how the body's all connected.
Sure, absolutely. From a mental health standpoint, and like Valerie had mentioned, the neuroinflammation that's happening. And we know that that's definitely there when it comes to, different mental health issues like depression, anxiety. Again, so helping to calm those nerves, to calm that inflammation that's happening within the central nervous system is definitely a great aspect of where low-dose naltrexone can help. Yeah.
LDN and fertility, one of my favorite topics.
Yeah.
So I actually talk about this pretty regularly to anyone who will listen, but I went through fertility treatments. And I feel like from what I know now, I would have been far more successful if I would have known about GLP-1s or LDN. And you go to these doctor's appointments and they're like, we're not sure why you have fertility issues.
Right.
And so then they do all these tests, but are they doing the right tests?
Sure.
Or PCOS is an inflammatory thing.
Absolutely.
And you just, now you know all this stuff and you're like, wow, I wish I would have known then what I know now.
Absolutely, yeah. And there's some really interesting research that's being done out of Poland and out of Ireland by providers using low-dose naltrexone to help with fertility. I have heard some wonderful anecdotal stories too on patients that have struggled with fertility and started using low-dose naltrexone, and really that was the only thing that changed for them.
It's amazing.
Was adding that on. And then they were able to have a successful pregnancy. So, there's a lot of great research, again, that's happening around this. And remember those, decreasing the inflammation, helping with autoimmune conditions, like Valerie had mentioned, that can often be the root cause for fertility issues for patients. And again, that endorphin modulation, supporting well-being. I mean, what a stressful situation that is for patients. And so anything that we can potentially offer them, that could have a beneficial impact on their mental health, could have positive effects overall.
Yeah. And of course, talk to your doctor about safe pregnancy, safe trying. But I think even some providers will add this on even during the first couple months of pregnancy. Is that correct?
Yeah, absolutely. If you have a patient that is using it, to help with fertility, a lot of those providers will recommend that they continue it through that first trimester. Again, because a lot of times they have PCOS or inflammatory conditions that were causing them to have issues. And in order to help potentially safely maintain that pregnancy through that first trimester, staying on that low-dose naltrexone to keep that inflammation at bay is an overall beneficial thing. So.
Next, we're going to talk about LDN and fibromyalgia, which is also something that I worked with a lot in retail pharmacy, and there just wasn't a lot of information out there about it. And I feel like we've heard a lot of stories about how patients have become very successful with their fibromyalgia by being on LDN.
Yeah, and that's just one of the things that I love to talk about too, because there's a lot of great clinical research out there on low-dose naltrexone and fibromyalgia. Fibromyalgia is really kind of like a mystifying, disorder. We don't know what causes it.
Right.
Every patient is different with what they, present as their set of problems. A lot of these patients will be put on antidepressants. Yes. They will be put on medications like gabapentin to help with pain. Yeah. And again, all of these other medications come with a whole host of negative side effects.
Absolutely. I remember seeing patients come into my retail pharmacy and you can't help them. It's like you said, you get antidepressants, you get gabapentin, but they're not actually feeling any relief.
Right, no. And so this study that I have up here is showing that up to 70% of patients who utilized low-dose naltrexone reported some type of improvement with their fibromyalgia symptoms. A lot of them too will report, they call it fibro fog. It's like a type of brain fog. Again, that neuroinflammation that we know low-dose naltrexone can really help to tamp down on.
And I don't know if we talk about this disease state specifically in here, but MS.
Yeah.
I've heard some anecdotal stories from patients where this is really benefiting their MS.
Yes.
And tell me a little bit about that, because this is a disease that is also very much like not well understood. We think that it's not helpful. There's not a lot of medication out there that can help, but the LDN has been shown to be potentially
low-dose
beneficial.
Naltrexone, has been studied for decades actually in multiple sclerosis, and I would definitely refer you back to the LDN Research Trust. There is some wonderful, wonderful literature that they have put out on low-dose Naltrexone and multiple sclerosis. I even had a wonderful anecdotal story of a woman that I met on the beach one time. Our kids were playing in the water and we started talking. I found out she was a nurse. She found out I was a compounding pharmacist. And she told me, she said, I love low-dose naltrexone. I'm on it. And I said, do you mind me asking what you're taking it for? And she said, I was diagnosed a few years ago with MS. And she said, I looked at all of the options that were out there for me to use to keep this disease at bay. And she said, I decided to start with the low-dose naltrexone. And she said, and that's all I have been on for years. And I have not had any progression in my symptoms.
That's amazing. Yeah. That's absolutely amazing. So I'm glad that we have this option for that as well.
Yeah, absolutely.
Next, we're going to talk about Hashimoto's, which we touched a little bit on at the beginning, but can be very helpful for patients with this disease.
Yeah, again, Hashimoto's, an autoimmune condition. We know that low-dose naltrexone helps with modulating inflammation within the body. Again, that TLR4 antagonism, it decreases those inflammatory cytokines that are happening. It increases endorphins, which helps with mood. I think one of the most exciting things about utilizing low-dose naltrexone for Hashimoto's patients is that oftentimes they are either able to decrease the amount of thyroid medication they're on, or potentially not even have to be on any thyroid medication, which I think is a wonderful, wonderful, option.
Yeah. What I've heard from some people who take it for this disease state is that maybe they were not, the levels were constantly changing.
Yeah.
And once they got on LDN, it was
stabilized. Yeah.
Correct. Mm-hmm. So that's something that we've heard from patients time and time again.
And so this is one of the conditions, though, that I do recommend you want to monitor patients closely if you start them on low-dose naltrexone with thyroid disorders, because of the potential for needing adjustment down, usually on the thyroid medication. So definitely, this is a condition where we say start low and go slow.
And grab those labs, right?
Yes.
Let's do those labs while we're starting it.
Yep, for sure.
Absolutely. LDN and cancer. Yeah. I actually attended a talk that was not by you that talked about actually pancreatic cancer.
Oh, yes.
And just what I saw from that lecture was astounding. Yeah. Because when you hear pancreatic cancer, it's not the best one to hear about. No. So tell me a little bit about this.
Yeah. So low-dose naltrexone, when it comes to cancer, it can potentially block the opioid growth factor receptor within the cancer cells. And so there's a lot of things that will happen because of that. we have an increase in apoptosis of the cancer cells. We have a decrease in proliferation. It also potentially increases the cytotoxic activity of chemotherapy. So using it in conjunction, with chemotherapy agents. So cancer cells have a very high expression of the mu-opioid receptor. And so we know that naltrexone, low-dose naltrexone, really targets that and can have a good outcome for patients. I can even just tell you anecdotally, I personally know an oncologist, and I quote, he said his words were, "I love low-dose naltrexone." And so that was very exciting for me to hear.
And I want to be very specific about this. Make sure you're talking to your provider, make sure you're talking to your oncologist, because this will go in with your other therapy, your other, on oncology, your radiation, whatever you're doing. You need to make sure your oncologist is aware that you're on this medication. But definitely bring that up to them whenever you're in your treatment.
And even the potential for it from a preventative standpoint, even. When it comes to cancer. So, exciting research being done in this category.
Sure. Oh, long COVID. We know everybody, or not everybody, but lots of people talk about it, and we're still dealing with people who've had COVID or long COVID symptoms for such a long time. And that LDN has some potential benefit here.
Yeah, I mean, really hearing about this more and more. And again, another area where there are some great clinical studies. And long COVID falls into that sort of, kind of mystifying realm, just like fibromyalgia, where there's, a lot of different symptoms that patients are having, and no two patients are really alike.
And fairly new to us, right? I mean, we just went through the pandemic 5 years ago, so long COVID is a new disease state for us.
Right. Again, so by decreasing inflammation through blocking of the TLR4 receptors, potentially regulating pain through the upregulation of endorphins, again, those are the mechanisms by which LDN can potentially help with long COVID.
We're going to get into the dosing with the autoimmune and inflammatory disease states. So like we said, we went over the weight loss dosing, and this dosing is going to be a little bit different.
Right. So this will be for all of these disease states that we've just talked about, whether it's irritable bowel, multiple sclerosis, Hashimoto's, cancer. So for these patients, we are going to work them up to a dose of about 4.5 milligrams. And so the starting dose is going to be on the lower end. It's going to be a quarter of a tablet. We'll talk about our fancy flex dose tablets in a minute. But they'll start with a quarter of that tablet, and then they'll work their way up by increasing gradually over 1 to 2 weeks. So you start at a quarter, then you go to a half, potentially 3/4, or some patients just go from a half up to the full tablet. Either way, again, at the discretion of your provider, how you're titrating. Certainly some patients too, if they are more sensitive to medication, I will recommend a slower titration for them, whatever works best for them and what their provider thinks is best.
They kind of go based off of their symptoms, the side effects they're having, if they're having any, and you can move up faster if they're not having any, or whatever works for the patient.
Yeah. The other beauty too of titration is that if a patient gets to a dose where they are feeling better and they have symptom improvement, they can stop. You don't have to always work up to that full 4.5 dose. If someone gets to a point where it's working for them, then I say stick with it.
Lowest effective dose. That's what I like.
Yep.
The flex dose tablets. So this is something that Strive has created, and we're very proud of this innovation that we have. But these tablets, and I apologize that I don't have any here to show you in person, but they're small tablets, and you just place them down on the table, score side up, and you press with your thumb, and it evenly splits it into 4 pieces.
Yes.
So we don't need any pill cutters. We don't need any crazy things. It just splits it evenly. So if your patients are titrating up, you're doing the quarter of a tablet. They can break it there.
Yeah.
And then if they're doing half a tablet, you just take 2 of the pieces.
Exactly.
But if they're at the full tablet, then they just take the full tablet.
Yeah.
So it's a really cool design.
Yeah, it is really neat. And I think one of the other things that we're really proud of at Strive is the fact that our low-dose naltrexone is so clean.
Yes.
Meaning that the only ingredients that are going to be in there are the naltrexone itself and a prebiotic filler. And that's it, nothing else. We don't have lactose, we don't have magnesium stearate, we don't have preservatives, there's no dyes.
And what's that prebiotic filler from?
Yeah, so it's from beets.
Yeah,
yes.
It's from beets. So where people get asked us, do you have gluten in your medication?
Yep.
We do not in low-dose naltrexone. So like she said, we get these questions all the time. What is in there? It's just the naltrexone and the prebiotic filler, which is beets.
Exactly. And again, this is something, for people who are vegetarians or vegans, staying away from most capsule products are made with gelatin capsules. Again, this does not contain any animal products, so friendly for religious purposes, vegans, vegetarians. We're just super excited about how innovative these flex dose tablets are.
For sure. And we do have some other products in our flex dose tablets. Feel free to go on strivepharmacy.com and look around, but you'll be able to see them on other Strive sessions. Oh, here's the video. So normally we do score side up, but this is a great video to show you how they go into quarter tablets.
Yeah, as my daughter says, it's so satisfying.
It is very satisfying. And we've had placebos that I take around to providers' offices. Yeah. They are a hit.
Oh yeah.
So you just very easily split. And I think even people with dexterity issues, when you're in retail pharmacy, you see people trying to use pill splitters or, pill scores, and it's very difficult.
It is, yeah.
Especially for a tiny tablet.
Sure.
And this tablet is pretty tiny.
It is.
So, really great that
And to your point, we actually made the design specifically so that it could be broken with your fingers versus a lot of commercial tablets that are out there, even though they are scored, you can't break them with your hand. Yeah, so that was intentional on our part to make it easy for patients to break.
I actually have a side story. I have a dog who needed heart medicine, and I had to split these tablets in half, and they were the smallest tablets, and I'm over here using a pill splitter, and I never got it right. It was never perfect.
Yeah. No, our flex dose tablets are just amazing. So here we just have our list of the different options that we have for the strengths. We have it available as 1.5 milligram, 3 milligram, 4.5, and 8 milligram. Remembering that 8 milligram dose is what patients are going to utilize for weight loss potential. The 1.5 milligram is a great option for pediatric patients who are using low dose naltrexone and offers them, kind of child-friendly dosages too.
And one of the great things about the flex dose tablets that we haven't touched on is that before we had these, you had to make a different capsule for each strength. So it was costing the patient or the provider multiple prescriptions, and now we don't need to do that.
No. So it's cheaper, it's more convenient all the way around.
Absolutely.
Yeah.
Oh, we're going to talk about side effects and missed doses. We're going to talk about one of my favorite side effects. But yes, LDN is generally well tolerated, but tell us a little bit about some of the other side effects.
So the most common side effects that patients can expect to experience are going to be some mild sleep disturbances or vivid dreams. And I like to say, if you're having the vivid dreams, that means your LDN is working. Yeah. So usually what happens is LDN helps patients to spend more time in REM sleep. REM is that restorative dream sleep. So that's why we see that increase in vivid dreams happening. It's because those patients are spending longer time there. Another favorite anecdotal story I have is a patient who wears one of those Aura rings.
Sure.
He said to me, he's like, I'm not sure I feel anything necessarily from being on the low dose naltrexone, but my time in REM sleep has drastically increased.
Oh, amazing.
Yeah. So
those Aura rings give you so much data. It's fantastic.
So he said, while I might not necessarily feel something, I know that I'm benefiting from the increase in REM sleep that I can see is happening through my wearable device.
Yes, and if people already have vivid dreams or they have that side effect, know that we usually ask that they stay on it for about 2 weeks to see. Normally they'll either become used to it or it kind of subsides, and then that's when we can move up.
Exactly, yeah. It generally subsides, and again, this is why we recommend titrating up and starting at that lower dose and gradually moving up to mitigate some of those sleep disturbance side effects. Also, headaches, mild GI symptoms are potentially there as well.
Well, we're potentially fixing some of the gut, so it is that's to be expected.
The system is getting used to it. Yeah, for sure.
Absolutely.
Yeah. Also, there's no need to make up a missed dose of low-dose naltrexone if someone forgets to take it. You just take it the next evening at bedtime. I will say, if a patient has been off of their medication for more than 4 weeks, we would recommend reinstating the titration again.
Absolutely. LDN and surgery.
Yeah, it's always an important topic to talk about because obviously we say patients that are on opioid medication should not take low-dose naltrexone. Obviously, when it comes to surgery,
most people in surgery are going to have some opioids on board.
Right, opioids, anesthesia. Because low-dose naltrexone has a relatively short half-life, we're talking 4 to 6 hours here, it's usually cleared from the body within 24 to 48 hours. So we recommend stopping low-dose naltrexone about 48 hours prior to surgery. And then if the patient is taking an opioid after surgery for pain relief, once they've completed that course of therapy, they can reinstate their low-dose naltrexone again.
Yeah, absolutely.
Yeah.
Oh, before we get into supplements, which I love talking about supplements, if a patient is maybe getting off of opioids just in general, when can they start? Maybe they've been on opioids a long time.
Sure.
When can they start taking LDN if they would like to do so?
Yeah, and very well-versed prescribers will actually use what we call very low-dose naltrexone to help patients wean off of opioids. And so they'll start at even potentially microgram doses, lower than what you saw on our earlier chart, and then gradually work up on the low-dose naltrexone as they're weaning off the opioid. This is, again, a really potentially exciting option for naltrexone, low-dose naltrexone that's out there. And again, great studies that show that this can be done and brings success to patients that are looking to get off of long-term opioid use.
Absolutely. Mm-hmm. And just coming from retail pharmacy, like I've talked about, I'm a huge proponent of let's get off the opioids, and if patients are ready to do so, then this can be an option, potential benefit. Yep.
Yeah.
So Strive supplements, we love Strive supplements.
Yes.
Our coworker Joey created a line of supplements that we love to talk about.
Yeah.
And let's talk about Digest and how it works well with LDN.
Yeah, so if you remember, we talked about low-dose naltrexone and irritable bowel, how 90% of our immune system is within the gut. So obviously supporting gut health and digestion is extremely important. So that's why our Digest supplement is a great option for low-dose naltrexone. Yeah. Also, our Regen, which is a longevity support. Yeah. And low-dose naltrexone, again, potentially part of a wellness and longevity protocol because of the potential for helping neurodegenerative diseases, like we talked about. Again, remember, it decreases the inflammation of those neuronal cells within the central nervous system. So decreasing that inflammation is going to have an impact on those disease states down the line.
Yep.
Yeah.
Also, just take any of these without LDN.
Sure, absolutely. They're all great, yeah.
We also have Restore, which is one of our sleep supplements. We have 2 sleep supplements, one with melatonin and one without.
Right. Yep. And we know that low-dose naltrexone can help with sleep, and then also, again, Shield is our immune booster. And, the immune modulating properties of low-dose naltrexone make those a great combination.
Absolutely.
Yeah.
Some references, and then thank you so much. This has been really fun. I love talking to Megan, and I know I love hearing about LDN from you. Yeah. So
thanks. Yeah. And again, thanks for joining us from A4M here, 2025 Longevity Fest. We were really excited to do this Strive sessions here. Valerie, thank you so much
Thanks for having me. I love being here with you. So we also will have a live Q&A session after this, so please stick around. We'll switch over to that. And thank you so much for joining us.
Thank you.